I'm Emily Wells, researcher here at the Centre for Social Justice. Over the last year, we have been researching what has driven the recent rise in mental ill health, which has culminated in the launch of our most recent report, Change the Prescription, a new approach to mental health. A brief trigger warning, there's a lot of sensitive topics in this report, and I'm going to be talking through some of them during this presentation. So who we've consulted, we've gone across our alliance of over 700 charities and spoken to many of them, many charity leaders themselves, as well as people with lived experience who are beneficiaries of those charities. We've held 8 focus groups and 4 roundtables. We've also polled GPs, the general public, and we've conducted thematic analysis of our call for evidence. We've also analysed various public data sets. So a quick run through of some of the data that's in the report. Firstly, the number of people in contact with mental health services in England has risen 70% since 2016. We're now at nearly 2 million people in contact with mental health services. 20% of people have at least one diagnosis of a mental health condition. A quarter of children are projected to have mental health disorder by 2030 if current trends persist, according to our analysis. And the suicide rate is at its highest point since 1999 for males and 94 for females. Hospital admissions for self-harm among girls aged 8 to 17 have more than doubled since 2007. And there's been a 21% rise in the rate of adults taking antidepressants since 2015. Nearly a fifth of adults are now on them. And the most deprived are almost 1.5 times more likely than the least deprived to be taking antidepressants. There's also been a 4-fold rise in the rate of adults taking CNS stimulants for ADHD since 2015. But why is this happening? We've identified 3 areas that the government needs to address. The first is the erosion of the protective factors which foster positive mental health. Firstly, we look at biology. Do genetics cause mental ill health, or is it the environment? There's an increased likelihood of developing mental ill health if a parent has it, and there is growing evidence of specific genes that may be inherited, but largely the current consensus is that there are a combination of factors at play in what causes mental ill health. We look at physical health and substance misuse, which are both quite intuitive. Both of these issues are making more likely to have mental ill health. We then move on to some more conventional social and psychosocial factors. The first being family breakdown. Does it cause mental ill health, or does mental ill health cause it? We look across a variety of factors, including the rise in domestic abuse in recent years, where in more stable families, there is a much lower rate of domestic abuse, which is heavily correlated with a risk of developing mental ill health. There's also been a 33% rise in the number of women accessing perinatal mental health services between 2022 and 2024. We know that parental mental health is heavily associated with children's mental health, so it's really important to look at the parents' mental health. We also look at trauma separately and adverse childhood experiences, which came up so much in the field research as well as in the literature. And in education, there's been a 62% rise in the number of children requiring SEN support or an EHC plan for social, emotional, and mental health needs since 2015. There's also been a 161% rise in severe absence since the pandemic. It's clear that mental ill health is causing at least some of it, and therefore impacting education. We also briefly touch on debt and housing, as they've come up a lot in the research as factors which can contribute to wellbeing issues. The second big chapter is a post-pandemic perfect storm, which has strained our safety net. We look at COVID, the pandemic, lockdown, and isolation. In 2022, the World Health Organization reported a 25% rise in the prevalence of anxiety in the first year of the pandemic. And thematic analysis of our call for evidence revealed that the most cited reason for the rise in mental ill health was the cost of living crisis. A study by King's College in October 2023 found that 60% of Britons said the crisis was negatively affecting their mental health. There's also been a huge rise in economic inactivity, particularly for young people, and now more than a half report depression, bad nerves, or anxiety. Our analysis reveals that you're 1.72 times more likely to report having a diagnosed mental health condition if you're completely dissatisfied with your job compared with those who are neither satisfied nor dissatisfied. But the evidence says that good work is good for you. 94% of fit notes deem people not fit for work, and 50% of fit notes for mental and behavioural disorders are now for the long term. Meanwhile, a lack of access to NHS services has seen more people stuck on wait lists. In 2019, the NHS said that they aim to see 1.9 million people accessing NHS talking therapies by 2023-24, but recent data reveals that just 1.26 million people have accessed those services. And the bulk of this chapter looks at social media and smartphones. Our analysis reveals that you're 1.73 times more likely to report having a diagnosed mental health condition if you use social media every day compared with never using it. We've heard up and down the country of the impact of social media and smartphones on the mental health of particularly children and young people. We find that this is often resulting from harmful content which is pushed through algorithms. The harmful content that we explore include the promotion of self-harm, suicide, eating disorders, and also the harms that come with cyberbullying, pornographic content, and exposure to violence. We also assess the impact of the addictive nature of smartphones. And while some argue for the connection that smartphones and social media bring, as well as that some apps promote well-being, we conclude that the harms outweigh the benefits. Finally, the prevailing medical response is not effectively addressing this crisis. We looked at all NHS mental health trust websites, and content analysis revealed that just 3 of those 49 trusts define mental health at all. The cultural turning point in 2007 was the first time that the statistic that 1 in 4 people will experience mental ill health became general knowledge, which has been very beneficial for reducing stigma. But we have also heard in this research that stigma remains in some communities, and particularly for those with more severe mental ill health. Has increased awareness risen with increased understanding? We've also seen a glamorizing of mental ill health on social media, and a rise in recent AI chatbots has seen digital therapists in some cases make fatal mistakes. This can lead to self-diagnosis, which in turn can be harmful if someone is misdiagnosed. Why is this happening? In the wider field of psychiatry, the rising classifications of mental ill health may have contributed. The Diagnostic and Statistical Manual, the 5th edition, published in 2013, saw widespread criticism for expanding the realm of normality, now described as disorders. And our polling reveals that 84% of GPs agree that society's approach to mental health has led to the normal ups and downs of life being seen as medical problems. This has seen psychiatry face confusion over what a disorder is. Does it describe symptoms, or does it seek to determine the cause? This has also brought into question the reliability of psychiatry. Following the publication of the DSM-5 in 2013, various studies found low reliability in diagnoses of certain common mental disorders. Given there's generally no biological marker for psychiatric conditions, diagnosis is often determined by a survey or structured interview. Some surveys are deemed to have varying levels of reliability. And the rising classifications has been deemed by some to create fuzzy boundaries in which more people view their symptoms as mental ill health without proper psychiatric understanding. And this can result in misdiagnosis, overdiagnosis, and overprescribing. Now, nearly 1/5 of adults are taking antidepressants, yet our polling reveals that 83% of GPs are concerned that antidepressants are prescribed when non-pharmaceutical interventions would be more suitable. But how do antidepressants work? The chemical imbalance theory says that neurotransmitters such as dopamine and serotonin are not transmitting, and antidepressants increase those transmissions. But even the NHS says that it's not entirely clear how antidepressants work. In 2021, the government revealed that 10% of prescriptions in the UK were not only unnecessary, but may have also been harmful. And some argue that antidepressants are prescribed so frequently as a result of pharmaceutical industry incentives. For others, the lack of knowledge about how antidepressants work is enough to reduce prescribing. Either way, antidepressants are often the first response contravening NICE guidelines. Why is this happening? It may be because of a lack of time and appointments, a lack of access to other services. 85% of GPs are concerned that antidepressants are prescribed because non-pharmaceutical interventions are not available. And the resulting concern is that some treatment is better than nothing. But our general public polling reveals that 65% think the NHS should prioritise addressing the root cause of less severe mental ill health through social prescribing or therapy, compared with just 12% who think it should be addressed through medicines. And during our field research, during some of our focus groups and roundtables, we heard from those with lived experience, as well as some professionals who are working and campaigning to reduce the effects of harmful online content, as well as charity leaders who are concerned about the current approach. In terms of our recommendations, we want to see family hubs delivered in every local authority. We want to increase the age of digital consent from 13 to 16 and oblige Ofcom to create a code of practice for safety by design features for algorithms. We want a ban of smartphones in schools and a public health campaign to highlight the risks associated with developing mental ill health. We want a new national work and health service and welfare reforms so that those with mental ill health receive targeted support. We need better diagnostic and prescription processes. And we want to see a national strategy for social prescribing with a particular focus on children and young people. Thank you so much for your time listening to this presentation. And I want to extend a particular thank you to all of those charities, professionals, and those with lived experience who have contributed to this research. Please do not hesitate to get in contact with us if you have any questions.